Thank you all very much for coming today. It's a very exciting opportunity. We are absolutely delighted to be here and to be joined by such a wonderful panel. I'm John Roman. I'm a senior fellow at NORC at the University of Chicago, where I study economics of crime and justice, and I am the co-chair of the National Prevention Science Coalition to Improve Lives. Betty Fishbein is the co-chair and the founder of NPSC, and we're the organizers of this event and this panel, and we're delighted to have this unbelievable group joining us today. So let me thank them. Let me thank Bobby Scott's office for being wonderful supporters of evidence and prevention science over the years, and the Judiciary Committee for giving us use of this fantastic room. I want to thank our panelists that Danny will introduce more fully in a second, but Dr. Patrick McCarthy from Annie E. Casey, Dr. Adam Gemmerin from William T. Grant, John Barron from Laura and John Arnold Foundation, Dr. Wilson Compton from National Institute on Drug Abuse, and Dr. Joan McLaughlin from the Institute of Education and Sciences that we just call IES. I couldn't remember what that was before. And then, I'm sorry, apologies, I have to thank our sponsors. We have a traveling roadshow at the National Prevention Science Coalition, and without their support we wouldn't be here and able to host these panels. The Paxis Institute, PAX, thank you to the Annie E. Casey Foundation, our supporters, Global Alliance for Behavioral Health and Social Justice, and the Coalition for the Promotion of Behavioral Health. So we're starting a little bit late, apologies, but we are live on Facebook Live, let your friends know. And we're going to go to about 3:30 thereabouts, and then we're going to have a reception, which will be in room 2045, wine and cheese and crackers, which is a nice way to spend a Wednesday evening or early afternoon, however you look at it. So let me just tell you 1 second about who we are at the National Prevention Science Coalition, why we're here today, and why we thought this panel was so exciting. So the National Prevention Science Coalition is interested in promoting the ideas around evidence-based prevention science, which we believe can help promote a more vital United States in all sorts of dimensions in health and public health and education and in better jobs and reduced interaction with the criminal justice system. And we believe that those investments must be made very early. That is the prevention component in this, right? You invest early. The problem is, of course, you get outcomes that come much later and are very hard to capture and measure. It's very hard for the people who finance these things up front to get credit for them, and so there isn't a lot of incentive for people to do this. And that's a central problem that we have, and this is a central problem that foundations face and the government face. And what we're interested in today is having a specific discussion about that dynamic. Where does government intervention, particularly around financing and implementing evidence-based prevention science, and where does the philanthropic world's interest and investment in that world begin? Do they actually understand what each can and cannot do? And does it matter for an audience such as this one? There are lots of reasons why, perhaps in the real world, in the real political world, on Capitol Hill and in capitals around the states, why there isn't as much investment in evidence-based prevention as we think would be optimal and make society better if there was more of it. And we'll discuss a bunch of the reasons why there are those limitations, but I just wanted to highlight one really quickly. As these guys know, because I subjected them to it this morning at another event at the Society for Prevention Research annual meeting, I'm reading Walter Isaacson's biography of Leonardo da Vinci, and it's really captivating because here's this guy in the 1490s who's engaged in these anatomical studies and these engineering studies and this really basic scientific inquiry. At the same time, he's an artist. He's one of the original scientists. And what really struck me in reading this was that he's motivated in his inquiry by both experience and experiment. And he refers to these two things as esperienza. If you speak Italian, I apologize for that. Esperienza, which captures both experimentation and experience. They were the same thing. And the Renaissance person who was engaged in all sorts of learning in science and art, they were the same thing. And my concern is that when we approach these topics of how to invest in prevention science when it's really hard, because we can't capture the benefits really easily today and credit the people who deserve it today, that people fall back on other things. They fall back on their experience as their guiding principle for what we should do. And I'm going to give you one quick example. I'll turn it over. I'm way over. But I think that one of the things that people tend to turn to do prevention science is mentoring, right? And I think that what the evidence-based literature suggests is that tutoring is really what we want to do. Tutoring, which is teaching somebody to engage with a defined curriculum that has been evidence-based, rather than mentoring, which tends to be sort of more of an ad hoc endeavor, and it's really well-intentioned, but its outcomes you would expect wouldn't be as far along. But experience teaches us that that mentoring relationship is really critical, and evidence can tell us, let's structure that mentoring relationship in this tutoring framework and achieve even better objectives. So that's what we want to do today, is sort of convince you to take your experience about what works in the universe, tie it together with evidence, and use that to arrive at the conclusion, which I think you inevitably will, that prevention science is something that we should do more of in multiple domains and care more about as a way to make our society better. So with that, I will turn it over to Denny Fishbein, who is the co-chair of the foundation, who is the driving force behind this, the sort of heart and soul of prevention science in America, and can say these things much better than I can. And she'll moderate this panel, and then we'll get to the wine and cheese as fast as possible. So thank you very much.